Okay, it's May 13th, 2020, and I thought I would do a long summary for people who have been watching. My intent is never to keep talking past when I believe I have new research or new finding. I track the NATO couriers for the simple reason the NATO couriers and couriers in military intelligence with diplomatic immunity move this stuff. Research is done between these laboratories with they're weapons grade viruses, weapons grade bacteria. It's the same exact agency, the DTRA, that moves the uranium. So when I see people with IP addresses in China, if it was just an IP address, a NATO couriers that, let's say, had IP addresses in China, if it was in Wuhan in 2020 around October, I'd say, well, that's probably because there's a lot of people going to the games. These people could have been in the entourage going to the games in Wuhan. But when I see IP addresses going to a different city, Nanjing, where the institute is with the Johns Hopkins University, which is this surveillance, health surveillance alliance for these diseases, mainly because most of these diseases, swine flu, H1N1, avian flu, and so forth, start in China. That's why the health surveillance is there. When I see IP traffic going back with Singapore statistics into 2016, it tells me that this person could be a part of, or whoever is doing this communication, let's just put it that way, is part of the joint task force called the Joint Reconnaissance Task Force at Fort Belvoir. So you have people that kind of deploy, which is Task Force Orange. They have the assets, they have the drones, they have the satellites, they have the planes, they have the helicopters. Most of them unmanned, interestingly enough, making it accessible for a cabal. And then they're finding and fixing. But now when you throw in spraying, you're not just finding and fixing for someone and saying, here's the terrorist. You're also now in the business of potentially deploying a weapon. Could be a low-intensity weapon, like a virus. But all of a sudden, Task Force Orange moves from find and fix to start to finish. Not finish totally, not death totally, but you can start the finish. You can start weakening the immune system of the enemy, or you can dust the enemy so that you can do tracking later on. So Task Force Orange we focused on at Fort Belvoir as the kind of the sword, if you will. And the shield is typically the vaccine that gets deployed, but also you want to do reconnaissance. You want to do tag and trace. And you see so much of this on the news now, people pushing this health reconnaissance, tag and trace, these apps to say, you know, when you're within 6 feet of someone who's been infected, an app will automatically report all the people that have been within 6 feet of you so that they can be sent an email by the government or a letter by the government saying you must come in for testing. This sort of social control, low intensity warfare type of idea is also done at Fort Belvoir. And again, it comes from, it's the hand in glove of the deployment of the bioweapon. You need to then, the problem with the bioweapons in the past, as well as both the viruses and the bacteria, is distribution. It's deployment, and evaluating the effectiveness of the deployment is critical. The reconnaissance is every bit as important, if not more important, in improving the weapon than the original bioweapon itself. So when I see people on the joint task force, plus you have to identify where the dead bodies are. So when I see people involved in the movement of dead bodies in highly infectious diseases with DTRA to Scott Air Force Base, when I see that whole sort of reconnaissance team with this communication to the Nanjing lab in from 2016, May 4th, 2016, I look at that and I say, okay, this is interesting. This seems like a reconnaissance team. It doesn't seem like just like somebody who is on a trip going to a bicycle race and then coming back. It's not to Wuhan. The IP addresses are not to Wuhan. And they go back to 2016. And they're with a company called Singapore Statistics, which does this tag and trace. So there's no questioning this. They're with a unit that goes through Scott Air Force Base that is tasked with tracking and bringing highly infectious deaths to Scott Air Force Base for later processing. Experiences where we're going to let the public pay for all the DARPA research, the Defense Advanced Research Projects Agency, and then we're going to commercialize it. I don't like DARPA stuff because it just is too ripe for commercial exploitation. The other thing that doesn't sit with me well is this 500,000 test kits that fly into just a little north of us here to Baltimore, to BWI Airport, Baltimore Washington Airport. 500,000 test kits, PCR test kits that are not on the FDA approved list. I could see if Hogan was trying to get, Governor Hogan here, was trying to get test kits because he didn't have access to them, or he just wanted to be double super sure. But they're not on the FDA approved list. There's about 12 that are for the PCR test, and these weren't. To me, that seems like a cover. This Ambassador Harris, when I see anything to do with Ambassador Harris, when I see anything to do with Moon, with the heads of state, this is the head of state of Korea, president of Korea, doing a back channel deal for test kits in an area where the testing accuracy is so important. We're all arguing over the number of deaths. We're all arguing over the number of people infected. It just seems like this is a collation. It just seems like, and again, no proof, but it seems like if I was using a human vector, remember they used the Moonies as human vectors in Korea. Now we have this Shin Chen On Chi, this sort of we're the only holy ones cult, and they're sharing food. They must share food. They have to be shoulder to shoulder. They're constantly being shouldered together so that they're sort of, the services are a human petri dish. There's these military proctors overseeing them, making sure that they share and get as close together as possible. People with coughs are not separated. They don't believe in the modern medicine. So if somebody has a cough, they're not separated from other people and displaying symptoms. When I see them opening up 30 different places around the world, including Wuhan, 5 different continents, growing 100,000 people in 10 months. To me, that just smacks of state support. To me, it seems like they've pulled together all the PCR test kits from all over the world from the surveillance, right? Brought them to Singapore, the National University of Singapore with Duke University. This is how Duke has done their southeastern surveillance for 20, 30 years. It seems like they're just pulling all the Asia and Africa kits back to a centralized repository and then flying them covertly under the cover of Trump's evil orange man ban, evil Trump. It just seems that way, and I don't have proof of that. But again, Governor Hogan can open the vault up and show us the PCR test kit, show us why you made this decision. But he doesn't. Instead, he shuts down the state of Maryland and says schools are going to be shut until next year, January, and then he says that we're not going to have restaurants until September. That's his response. So I think a lot needs to be talked about with these nanoparticles, these engineered particles in terms of testing. There hasn't been any testing that we know of unless they've done private testing, with the sort of Fauci fast track, the Redfield type tests, and the Redfield-Burks tests, which are illegal, and test people like prisoners or unsuspecting soldiers or students, worse yet. So those things give me pause. And then I also see DHS looming its head here again. It just seems like whatever gets deployed in the battlefield overseas, it takes about 4 or 5 years, whether it's satellite technology or this kind of low-intensity virus bioweapon. It just seems like it gets inculcated into DHS. And so I have a problem with that. We're just looking away. We're closing our eyes to all the evidence. We have Dr. Ramuzzi, Dr. DeCarli, the epidemiologist in Milan, saying that there's these ground glass presentations with these odd pneumonias in October, November, December of last year. Where are they? They're nowhere to be found. We can't talk about them. So it seems like they're being suppressed. We also have all these different presentations the disease is making, like it's this CRISPRed combination of viruses. We have the triple therapy for AIDS, the triple drug therapy for AIDS, to knock out AIDS. And now it seems like we have a triple virus in this. We have the HIV, we have the coronavirus as the vector, and who knows what else is in this, MERS, SARS, Ebola, etc., tuberculosis. We don't know the answer to it. We do know viruses travel in packs, and they travel better when they travel in packs. So that, I guess that's the number one thing that bothers me, is the multiplicity of symptoms, and then also the lack of sharing of the information. That also troubles me greatly. The original, again, going back to the AIDS situation and the HIV situation, I knew the law firm, and I knew somebody was a partner, not a partner, a lawyer at the firm that handling the American Red Cross case. This goes back in the 80s or early 90s, and contaminated blood. Contaminated blood was the number one way, best way of infecting somebody. If you took a transfusion, it was 100% sure. So if you were a dark soul of sort of a NATO Nazi, you could just simply interdict the blood supply, the blood serum supply, between these labs that are doing research. Unsuspecting lab folks that are amplifying the blood, making more blood cells from that cell line, trying to do research, are unwittingly passing on the virus. So the whole entire blood supply could be affected by just one NATO courier slipping them just one blood vial of some bloodline in a joint venture between the University of North Carolina and Wuhan, China, which we have 4 of those with Sina Bavari, or a joint venture with Harvard, or a joint venture with University of North Carolina, or a joint venture with Duke University. One courier with one bloodline, thinking that if it's a new novel virus, there's no test for it. They don't know how to decontaminate it. I remember that going through this for 1 million people. 1 million people they think have died because the blood banks withheld the fact that the blood supply was tainted. Again, if you want to create a worldwide pandemic with a bioweapon, the best way to do it would be start a new joint venture with a new joint partner, the Wuhan Virology Institute. Send them a bloodline that has the virus in it, unbeknownst to them, and I think that there is an uncanny similarity to SARS and HIV, which is the dominant thing. We've got Luc Montagnier, the guy who comes up with discovering the HIV virus, also saying this is a man-made virus. I don't know how you could get better than that in terms of a blue ribbon expert. I went through all this with Donnie O'Sullivan, by the way. He chose to leave it all out. He chose to leave out the NATO courier thing. He chose to leave out the Fort Belvoir. He chose to leave out the Task Force Orange. He chose to leave out the Singapore statistics. He chose to leave out the part about all the circumstantial evidence, the connections to Nanjing, the connections to Peoria, which may be just an anti-cancer recovery area that one of the couriers was going through. It could be something else. But that's not Fort Belvoir. That's not Fort Belvoir. It shows the person's in Illinois, in central Illinois, not Fort Belvoir. So I think it's health surveillance, but we'll see in time. Everyone's talked about Fauci's patents, so I won't talk about the patents. Everybody's talked about the Fauci fast track, including myself, so I won't talk about that. Bavari, we've talked about leaving the door open at the Fort Detrick. I think the reason they reopened it recently is just for none other than the reason of saying, hey, if it's closed down because of a security event, wouldn't you start looking there? Start looking at the BSL-4 labs, if there's 7 or 8 in the United States. If you want to see where it was released, start with the labs that got closed down because of security events. Start with the ones where the guy had the security event and then left and went and did startups, 4 startups at the University of Nebraska. If only one of the cell lines worked on at the University of Nebraska, got infected over the last 4 years, or one of the cell lines was infected from North Carolina, or one of the cell lines from the University of Texas, it replicates. It replicates. One unsuspecting lab assistant can replicate the virus, and it can go into 1,000 blood vials into hospitals all over. Now, the fact that it only affects Wuhan and none of the other major Chinese cities are affected also is very, very interesting. Also very interesting. You have a lot of different military people coming into Wuhan. We know that Senator Tom Cotton has told us that they shut down all the traffic around the lab. To me, that sounds like Imran Awan or somebody like Imran Awan, a courier, closing everything down. So remember, these are just like transporting nuclear weapons. They're just as deadly, if not more deadly than nuclear weapons. So to me, have you ever seen when they're transporting large missile systems or whatnot, they close the roads? Might that be an explanation? Again, more data. We need more data to get to the bottom of it. We keep seeing, it appears that the people doing the virus vaccine game, these emergent biosolutions and the eco-health trusts, seem to always want to put the focus on more money. They don't want to put the focus on the root cause. Root cause is everything. Root cause analysis is how you solve the problem. When I hear people who are trying to solve the problem not talking about root cause analysis, that gives me pause. Right away, I say, where there's smoke, there's fire. Virginia Banassi, who writes this blueprint for this virus vaccine game for the WHO, her relationship to Giuseppe Banassi. Giuseppe Banassi, we have a PowerPoint of him talking about how to get NATO contracts. How to get NATO contracts. He's running security. He's running all the interoperability for all the procurement of all the IT equipment all over the world. If you were running a spy ring in countries all over the world, if you're running a health surveillance system, again, you don't need the whole team. You just need your one person from the chief of staff to be getting a copy of the research. Wouldn't that kind of make sense? It's the center of interoperability for all the teams in all the different countries where all the different viruses are. And it goes directly and feeds Virginia Banassi's paper along with Sina Bavari's paper is a direct outcome of all that health surveillance. It's a direct outcome. It seems like you survey to see amongst all the labs, there's about 30 different DTR labs. You see the most pathogenic stuff on the horizon. You bring it all back to a central repository, wherever that is. I could guess it's the Pirbright Institute. I could guess it's Portendown. I could guess, it's one of these other places where we've seen them sell pathogenic viruses out the back door, like Portendown or Fort Detrick. But you bring it all back together. You go down the list of all the most pathogenic, and you pick the top 5. Then you're writing the R&D paper, remember. You're Virginia Banassi, you're Sina Bavari, and then you're going to pick the 5 that you already have the vaccines for. You're going to be able to market those out. I didn't come out with bio-innovations. I didn't come out with a startup that sold from bio-innovations directly to GlaxoSmithKline after leaving the door open at Fort Detrick. Sina Bavari did. So we still have lots of questions about patient 31 and all the data connected. If you look at the Washington Post article on the epidemiology in South Korea, you have all the first 30 patients, affect 2 other people, all the tag and trace, this tracing, contact tracing. And then so you get to this patient 31 who's 61 years old from this cult. And then you have a cohort of 5,000 that are infected and a cohort of 1,000 that are infected. Doesn't stand to reason. You had a huge portion of these folks, thousands, I believe it's going to be, not thousands, but it's going to be in the hundreds of these people in Wuhan, seemingly there through the whole time, the whole 10-month period leading up to these World Games. It's been a series of games. It wasn't just 10 games at the end of October. It was a series of games all through October and into September. And this cult comes back into Korea. It seems much more likely that these cult members coming directly back into Korea caused the huge numbers in outbreaks in South Korea, and not 2 people being infected here and 2 people being infected over there near Seoul. And then all of a sudden, now it's this huge breakout in Daegu. The much more traveled path in Korea is between Korea and Wuhan. Makes no sense that it would end up in Daegu unless there was a large pack of people, like from this cult, which we know is the number 1 cohort of infected parties, going back and forth. So a lot points to that, and those questions never were answered. Meanwhile, Johns Hopkins University tends to have cutout companies and ex-health officials around the country signing surveillance contracts. These people that are now being hired, these surveillance trackers and tracers. Vital Strategies, Tom Friedman up in New York, ex-public health director there, used to be with the Lung Association and Ebola, gets the contract with Bloomberg and Johns Hopkins University. Just seems like it's sort of like Fort Belvoir is the McDonald's, and all these different tri-state area surveillance companies are the franchisees. They seem to be the franchisees. Hogan with the 500,000 kits. That still gets me, making a deal with a foreign power. So there's another thing that hasn't been answered. There's also, with these NATO couriers, there's also this traffic to the Georgia Technology Authority. The Georgia Technology Authority is a authority near Georgia Tech. It's sort of a spinoff from Georgia Tech, working with the CDC. So that's just more evidence, I think, that the person involved with Singapore statistics, the NATO couriers involved with Singapore statistics, are working with the CDC, directly with the CDC. That's where diseased tissue goes for examination. It would be a natural control point to bring viruses back from where viruses are most prevalent in the Far East, back to a place like the CDC to get the inside track on what are the new emerging viruses, so that you could write the R&D blueprint, so that you could be the first with the vaccines, because you would have had the first crack at decoding the sequence. And then AFRICOM was a command before it got split off from EUCOM, which is the European Command, in 2011. So the last time that you could divert things from EUCOM was in 2011, as AFRICOM is being split off. So Africa was sort of the Wild West as far as bioweapons deployment, bioweapons testing. Everybody in our story, all of our NATO couriers are EUCOM, and going back to even Pete Buttigieg, all of our threats are coming from people who are involved in AFRICOM. It seems the death threats, the Jonestown or the threat that we got, or the Waco threat with the flamethrowers and so forth, comes from AFRICOM. Comes from, again, operations that were run by NATO called Ocean Shield, that again seem like diversions. There's really 3 Somali pirates take down this Dutch shipping company, the Maersk, Alabama. Is that really why we need to spend all that money in AFRICOM? Was there a secret war, unapproved war done in Libya with these blackberries, Stavridis? When I see people that are drivers for Stavridis who ran that war, remember Bouchard was the figurehead doing the NATO bombing campaign, but remember the Supreme Allied Commander has to be an American officer. So you have Stavridis there. When somebody's driving for Stavridis, that shows me they're going to know who Giuseppe Benassi is, who's doing the actual secure access program for the operation. Multinational operation, remember, you got to have a multinational military grade encryption in the blackberries if you're going to carry this off successfully. And we know Stavridis makes the island of Malta the jumping off point for all the dark weapons. We have really sort of a kind of an obvious indicator, a flashing red arrow saying, if you used these dark weapons all through Africa, in Libya, in Syria, in Sudan, in Yemen, who knows all the other places, Congo, Zaire, Zambia, South Africa, you name it, Zimbabwe. If you use them all through Africa for your mining operation, your drilling, or your oil or gas drilling operation, you don't want some president who you don't want in there in the first place upsetting that apple cart. If you could take a relatively safe virus and spread it, but create a psychological operation, but mix in a lethal virus to give the virus some teeth, maybe selecting out places that are reopening. The key here is looking at both the science information and the political information. One hand washes the other. A lot of people are doing one or the other. But what I'm saying is, you've seen how this technology has been used by General James Jones. Patrick Berge talked about that, to create bots, create all these bots. I had the bots hit me after the CNN article, all the CNN flying monkey bots that hit me. So I know ShadowNet exists. They're using their military tech to try to take down Trump. Isn't this just another tool in the arsenal for these guys? Isn't this just another tool in the arsenal? To me, it does. It seems like another tool in the arsenal. Of course there's a lethal strain. Of course this is deadly. It could be several lethal strains that we don't know about, right? And of course there's a safe strain where people don't even realize they get it, because you want to do that tag and trace pervasively, right? You want the lethality to put teeth into the virus, but you also want the contagion so that you can effect the tag and trace. Those are the things I see. That's all very military. Everyone wants to blame Bill Gates, but I haven't seen Bill Gates over at the National Defense University. I haven't seen him doing the simulations. We talked about the wild atom exercises that Bill Taylor ran, right? There's going to be a wild virus exercise that you don't know about. These are the most secret programs, right? Bill Gates isn't in those exercises. He's just on the front end. He's just on the marketing the virus. Hey, I'm a really rich guy, so listen to me, right? And that's why I don't hold anything back for people who say it's the Gates Foundation. I'm not saying they're not the front organization. I just think you have to look at it when it's a bioweapon. You have to look at generals. You have to look at Admiral Stavridis. You can't look at figureheads. You're never going to figure it out if you look at the figureheads. You got to go deeper into the task forces, the reconnaissance task force, the Task Force Orange. A lot of people say Task Force Orange, the way it got its color was Agent Orange. I don't think that's true. But I do think there was a rainbow of different agents dropped on Vietnam. So, and a long history in Korea with these, that's where our bioweapons program really flourished after World War II with these Nazi paperclip concoctions. And you say, well, why? Why? Because they had to justify their existence. Eisenhower wanted to discontinue the program at Fort Detrick. They said, we need a limited, low-intensity conflict where we're not trying to win, where we're trying to play for a draw. We're trying to play for a stasis, right? That's where we can test all these weapons. And it would be best if it lasted for 70 years because it was just repeated testing. We can constantly intermingle these people from the Shenzhen OG. We can constantly infect them. We can constantly send them across the border. And that program's been around for almost 70 years, going on 70 years now. It's the perfect place to run this campaign, and it hasn't changed since the day Sasakawa, the guy who ran the Japanese bioweapons program, affecting mainly Nanjing, right? Rape of Nanking, right? That immediately after the war gets taken to Fort Detrick, all that Japanese technology, along with the German technology, it becomes the basis of the portfolio of Fort Detrick. How are you going to deploy it in Southeast Asia from Fort Detrick? You need to have a courier. Dilyana, the woman writer from Bulgaria, showed us the people in moon suits, showed us the heavily armed guards, showed us how we had to block off the streets when we're moving a NATO courier in and a courier out for DTRA. Not my reporting. Reporting that happened 3 years ago. Okay, we just said emergent biosolutions 3.5 years ago, but we didn't have that DTRA piece until I was able to interview a lot of people, finding out that you could use DTRA to avoid the FBI Academy to get in the back door at FBI. So a lot of information, but I did want to do kind of a roll-up for people who hadn't seen some of the previous episodes. A lot of them were taken down by CNN or CNN's flying monkeys. So I wanted to give you a recap. So as we get more information, as we ask more questions, I still believe in open source. I believe open source is, look how effective it was for Imran Awan. There's still so many questions there. So many things in their Imran Awan story point toward, well, first of all, let's start off with having a drug lab with Rahm Emanuel. Not a lot of folks doing that. Being in a car dealership with the Ministry of Health for Iraq. If he hadn't had his problems with Medicaid fraud, if Al-Attar hadn't had his problems with Medicaid fraud and drugging his patients, he might be the head of the WHO. He might be the head of the WHO instead of Tedros, right? Tedros is from Ethiopia, a relatively small, minor country, right? It might have been Al-Attar. How about the Minister of Health that gets the thumb drive from Imran? Minister of Health gets the thumb drive in the Punjab. So we'll leave it right there. Thank you very much, and we'll talk to you soon.